Imagine handing a basic off-the-shelf smartphone and a portable ultrasound wand to someone who has literally never studied medicine a single day in their life.
Right, just an absolute novice.
Exactly. And after like a quick 2-hour training session, they scan a pregnant patient's belly. Then an app crunches that video data.
And the result is kind of unbelievable.
It is. The result is a pregnancy age estimate that is actually more accurate than one done by a highly specialized obstetrician with a decade of experience.
Oh, wild.
Welcome to the deep dive. You know the drill by now. We take a giant stack of sources, and in this case, we're looking at a dense 2026 systematic literature review.
By Johanna Schott and her team, yeah.
Right, from the journal Acta Obstetricia et Gynecologica Scandinavica. And we extract the absolute most important, mind-expanding nuggets of knowledge from it. We do the heavy lifting so you, the listener, can walk away as the most well-informed person in the room.
And I know that journal title sounds like it's designed to put you to sleep.
It really does.
But the actual findings inside are nothing short of revolutionary. I mean, we are looking at a fundamental shift in how medicine might be practiced globally.
Moving away from those centralized hospitals, right?
Exactly, moving directly into the community.
So our mission today is to figure out how this is even physically possible. We're exploring how the combination of artificial intelligence and a technique called blind ultrasound sweeps is, radically democratizing prenatal medicine.
It's basically turning novices into diagnostic experts.
Just with a smartphone and a wand. Okay, let's unpack this.
Yeah, so before we get to the flashy AI algorithms, we have to look at the gaping hole in healthcare that this is trying to fill.
The global bottleneck.
Right, because ultrasound is the undisputed gold standard for prenatal care. It tells the doctor the age of the baby, the physical position, the fluid levels around it.
Basically every vital piece of data you need to ensure a safe delivery.
It's exactly. Yet the World Health Organization estimates that up to 50% of pregnant individuals in low and middle-income countries receive 0 ultrasounds during their entire pregnancy.
Right, half. Half of the pregnant population gets none at all?
None at all. It's a massive blind spot.
That is just staggering. And looking through the review, it's clear this isn't, it's not just a geographic or low resource issue either. It's happening in highly resourced health systems too.
Oh, absolutely. Look at the United States. Maternal mortality is significantly higher there than in other comparable industrialized nations.
Right, I remember seeing that.
Yeah, and the disparities are huge. African-American women, for instance, are approximately 3 times more likely to die from pregnancy-related causes than non-Hispanic white women.
Which is a heartbreaking statistic.
It really is. And there are deep, complex structural factors driving that, obviously. But a huge piece of the puzzle is, differential access to timely, high-quality diagnostics.
Because if a provider can't see a complication developing in the womb, they simply cannot intervene in time. So the intuitive fix, if I'm just thinking about this logically, would be buying more equipment. Like send 1,000 portable ultrasound machines to rural clinics in underserved urban neighborhoods.
You'd think so, right? Problem solved.
Yeah, but I'm guessing it's not that simple.
If only it were. The machinery itself isn't actually the primary bottleneck anymore. Portable ultrasound probes that plug right into a phone are getting quite cheap.
Oh, really?
Yeah, the real bottleneck is human expertise. Becoming a skilled sonographer takes years of intensive training.
Because you have to know, the exact angle to hold the wand, right?
Right, and how to find a highly specific cross-section of a moving, squirming fetus. You have to freeze the frame at the perfect millisecond.
And then manually place those little digital calipers on a fuzzy gray screen just to measure a tiny femur bone.
Exactly. So you can drop a state-of-the-art ultrasound in a rural clinic tomorrow, but without the trained operator, you've essentially just donated a very expensive paperweight.
Which brings us to the actual solution they tested, which is volume sweep imaging, or, as they casually call it in the literature, the blind sweep.
Yes, the blind sweep.
And this completely abandons that traditional high-skill requirement. I want you, the listener, to visualize this. Think about a normal ultrasound experience.
The dark room. The cold gel on the belly.
Right, the doctor staring really intently at the screen, hunting around to find the perfect image of the baby's heart. Well, the blind sweep throws all of that out.
Completely out the window.
Yeah, a minimally trained health worker just takes the wand and moves it in a basic rigid grid pattern using anatomical landmarks.
They start at the belly button, sweep down to the pelvis, and repeat.
And they aren't even trying to find a specific body part in real time, are they?
No, they're essentially flying blind. They're
Oh,
purposely ignoring the screen, just capturing a continuous rolling video of the entire internal landscape.
it totally reminds me of mowing a lawn.
How so?
Well, traditional ultrasound is like walking into a massive overgrown field and trying to find one specific four-leaf clover.
Okay, yeah.
You need an expert eye, and it takes time. The blind sweep is like hopping on a riding mower, cutting the entire field in a systematic grid, recording the whole process on a GoPro, and then letting a computer program find the clover later.
That is a remarkably accurate analogy.
But I have to push back here. Because a sweeping video taken by someone who barely knows human anatomy has got to be chaotic.
Oh, it is.
The wand is tilting, the pressure is inconsistent, the baby is kicking. Can that messy footage actually yield reliable medical data?
What's fascinating here is that the messiness is the point.
Really?
Yeah, the true paradigm shift is decoupling the image acquisition from the interpretation. The video is chaotic to a human eye, sure. It's just a continuous blur of tissue and fluid.
It definitely lacks those pristine snapshots you print out for a baby book.
Right. But the AI doesn't need a perfect isolated photograph. It's built to analyze the entire chaotic sweep as a whole, finding the signal in all that noise.
Okay, so we've got novices doing the sweeping. The data is this rolling, blurry video. The natural next question is, how well can the AI actually interpret that video compared to a human expert?
Moving from the theory to the hard data.
Exactly, because to work in the real world, it can't just be a neat parlor trick. It has to be highly accurate. And the most critical test for that is estimating gestational age.
Right. Gestational age, or GA, is the absolute anchor of all obstetric care.
Because if you don't know the age, you can't manage complications, right?
Exactly. If a clinician doesn't know exactly how many weeks along a pregnancy is, they are flying blind. You can't diagnose fetal growth restriction, which is a major driver of stillbirths, if you don't know how big the baby should be today.
Right.
And you don't know if a mother going into labor is dangerously premature or right on time. Getting that date right is everything.
So researchers tested this in the Puckaberkarn study.
Yes, they did. They trained an AI model on over 20,000 of these blind sweep videos that had been fully annotated.
And then they put it up against standard human biometry.
Right, the traditional method where expert doctors measure specific fetal body parts to calculate the age.
Okay, so let's dive into the numbers. How accurate is the AI's guess compared to a real doctor?
This is where the data gets wild. The human experts had a mean absolute error, or MAE, of about 4.7 days.
So they were, on average, a little under 5 days off in guessing the true age.
Right, which is entirely standard and clinically acceptable in prenatal care. But the AI model analyzed the sweeping videos and estimated the age with a margin of error of just 3.9 days.
Wait, it actually beat the human experts?
It did. It literally beat the doctors.
That's crazy.
But the real mind-bender is the novice dataset. The researchers took community health workers and nursing trainees, people with absolute zero prior experience operating in ultrasound.
Right, the people with only 2 hours of training.
Exactly. Those novices scanned patients, the AI analyzed the video, and the margin of error was 4.9 days.
Wow.
And when expert sonographers scanned those exact same patients using their traditional painstaking methods, their error was 5.4 days.
Wait. I want to make sure everyone just caught that. A person with 2 hours of training paired with a smartphone AI was more accurate than a fully trained specialist.
Yes.
How did the researchers even verify the true age to know who was closer? Because human memory of a last menstrual period is notoriously flawed.
That's a great question. They used IVF pregnancies as the control group.
Oh, brilliant.
Okay.
Because with in vitro fertilization, the exact date of conception is known.
Exactly. It's documented in a lab. It is the ultimate, unarguable ground truth. And in that IVF group, the human experts were off by 3.6 days.
And the AI.
The AI was off by only 2.8 days.
Incredible.
And this wasn't a one-off fluke. The NAS meta-analysis confirmed this trend with a pooled error of 2.55 days for the AI.
Okay, here's where it gets really interesting. How is that physically possible?
What do you mean?
I mean, I'm struggling to understand the mechanics here. How can an algorithm looking at a blind, messy sweep be more accurate than a trained doctor looking right at a high-resolution image of the baby?
The secret lies in how the AI processes visual information over time. It uses convolutional neural networks and something called temporal encoding.
Temporal encoding.
Yeah. When a human doctor evaluates an ultrasound, they rely on macro architecture. They freeze the screen on a specific recognizable shape, like the head, measure it, and use that number.
Think of a flip book. A doctor is flipping through, finds one clear page, stops, and uses that single page to make their guess.
That's a perfect analogy. The human looks at one page because our brain simply cannot process the math of a moving image fast enough.
Right?
But temporal encoding means the AI is watching the entire flipbook in motion. It analyzes how the pixels change from one frame of the video to the next.
So it's not just looking for the outline of a femur bone.
Exactly. It's detecting microscopic texture features in the tissue. It's noticing subtle movement patterns and complex growth gradients across thousands of pixels that the human eye physically cannot perceive on a static anatomical plane.
Wow. So it's seeing the forest, the trees, the bark, and the cellular structure of the leaves, all in motion, all at once.
Precisely. It extracts meaning from the blur.
But dating the pregnancy is only step one. I mean, if this is going to be a true clinical tool, it needs to evaluate the actual health and position of the fetus.
Oh, absolutely.
So can it tell us about things like amniotic fluid? Because I know that's vital for spotting fetal compromise.
It can. Amniotic fluid volume is a great example. Too little fluid can signal poor growth. Too much might point to maternal diabetes. Traditionally, a sonographer has to carefully hunt for the deepest pockets of fluid.
Right, and make sure they don't measure the umbilical cord by accident.
Exactly. But the Chow et al. Study looked at this, and the AI was incredibly successful at segmenting these fluid pockets automatically from the blind suite.
The review mentioned a DICE similarity coefficient of 0.87, and just to clarify for the listener, a DICE score of 1.0 is a perfect overlap with a human expert, so 0.87 is incredibly high.
Which is astounding when you consider that amniotic fluid is constantly shifting shape in a moving video.
And it does the same thing with the fetal biometry, right? The Slimani study highlighted this.
Yes. When researchers tested its ability to map out the fetal brain and head, the AI achieved a DICE score of 0.95.
So basically flawless.
Practically, yeah. And it scored a 0.90 for mapping the abdomen.
That's amazing. What about the baby's position and the placenta?
The Stringer study showed the AI correctly identifying breech presentations where the baby is bottom first, with an area under the curve of 0.98.
So over 95% accuracy.
Right. And then there's the K. Lopez's protocol study.
Oh yeah, the placenta one.
Yeah. Knowing the placenta's location is critical for preventing hemorrhage. The AI improved the accurate classification of placenta location from 82% up to 94%.
And it bumped up cervix visibility from 28% to 91%.
Exactly.
It really is like a digital Swiss Army knife. You do one abdominal swipe, and this algorithm extracts 10 different health metrics from that one file.
It really is.
But let me ask you this. If the AI is this good at drawing a flawless outline of a fetal brain, does it actually understand what it's looking at, or is it just phenomenally good at coloring inside the lines of pixel patterns?
If we connect this to the bigger picture, that distinction is the most important concept in modern medical AI.
How so?
The algorithm has absolutely zero biological understanding. It doesn't know what a brain is or what fluid is. It doesn't even know it's looking at a human being.
So it's literally just math.
Purely math. It only recognizes statistical pixel correlations. It learned that a specific arrangement of dark and light pixels statistically correlates with the human label of brain.
That makes sense. It's pure pattern recognition.
Right, and that is exactly why it's so powerful. But it's also exactly why it requires human guardrails, because it doesn't understand biology.
Right, which brings us to the catch. Every disruptive technology has a blind spot. Where does this digital Swiss Army knife break or fail?
We definitely have to look at the limitations. The most glaring one right now happens at the very end of the pregnancy.
The third trimester drop-off from the Stringer study, right?
Exactly. The AI is brilliant in mid-gestation between 14 and 27 weeks. The error rate is tiny, around 3.2 days. But at term, meaning 37 to 40 weeks, it falls apart.
The error jumps to 11.54 days, right?
Yes.
Why does the AI suddenly get dumber right before the baby is born? You'd think a big, fully grown baby would be easier to measure.
Well, the AI isn't getting dumber. The biology is just getting messier.
Okay, what does that mean?
Not currently. The AI gets incredibly confused, trying to differentiate and segment two overlapping, moving fetuses in a single video.
It just kind of throws its digital hands up.
Pretty much. And also, it cannot detect rare or complex structural anomalies. If a baby has a subtle heart defect, this AI won't catch it.
So it's for basic screening, not deep anatomical investigation.
Exactly. And finally, there is a severe lack of data on diverse global populations.
Like South Asia or indigenous communities.
Right. Most of the training data comes from specific regions. If you apply it to a population with different tissue densities or genetic growth patterns, the accuracy could drop.
Because it's just looking at pixels. And diets, altitudes, and genetics change how tissue looks on a pixel level.
Precisely. Which risks severe algorithmic bias. This raises an important question regarding how we safely integrate these tools.
We can't make doctors overly reliant on them.
No, we can't. AI has to be a complement to clinical expertise, not a replacement for it. If the machine says one thing, but the human intuition says another, the human needs to know how to question the machine.
Absolutely. So, as we wrap up this deep dive, let's bring it back to you, the listener. Why does this matter?
Even if you aren't in the medical field.
Right. Because what we are looking at is a masterclass in task shifting. We are taking a highly specialized skill, digitizing the expertise, and handing the execution over to anyone with a smartphone and a few hours to learn.
It's democratizing knowledge.
Exactly. So what does this all mean?
It means the future of medicine is fundamentally changing.
It really is. And I want to leave you with a final mind-bending concept to ponder.
Ooh, I like these.
Think about this. If a 2-hour training session and a smartphone app can give a community worker the diagnostic accuracy of a specialized obstetric sonographer.
Which we just proved it can.
Right. How long until our own personal smartphones become the ultimate FDA-approved home diagnostic clinics for almost any physical ailment?
That is a wild thought.
I mean, are we looking at the end of the traditional waiting room? Could you just scan your own knee for a torn ligament from your couch?
It's entirely possible in the near future.
It really is something to chew on. Thank you so much for joining us on this deep dive. Keep asking questions, keep challenging the status quo, and we'll see you next time.